Hi everyone, my name is Amela. I will be doing my presentation on excoriation disorder, also known as skin picking disorder. I will be referring this to as ED just for short. I would like to first start off with the criteria. AD is listed in the obsessive compulsive and related disorders section of the DSM-5. ED shares many features with other body-focused repetitive behaviors such as trichomania or pathological nail biting. There are many similarities between ED and other obsessive compulsive spectrum disorders. ED criteria includes recurrent skin picking results in skin lesions, repeating attempts to decrease or stop skin picking, clinically significant distress or impairment in social, occupational, or other important areas of functioning as a result of skin picking. Picking cannot be due to the physiological effects of substances, and the symptoms are not better explained by another psychiatric disorder. Prevalence. Many articles have stated it is undetermined, though many articles did mention that it is 1.4% of the general population. AD has a tri-model age of onset, which means individuals before age 10 uh, could possibly develop it between ages 15 to 21 and between ages 30 to 45. And females have reported that they are more likely than males to develop it, and it is a 8-to-1 ratio of female to male. I also want to point out that the prevalence of ED may be underestimated as it is sometimes overlooked, particularly because of comorbidity with other mental disorders, which I will be going through in the next slide. Many people with ED also go to extreme great lengths just to hide their behaviors from others and family members just because of the fear and embarrassment of the skin picking and the lesions and the scars that they do develop over time. So, going back to the comorbidities, different disorders, 41% to 65% of patients found to have an anxiety disorder such as agoraphobia, social or specific phobia, obsessive compulsive disorder, post traumatic stress, panic disorder, and generalized anxiety disorder. And then we have 48% to 68% of patients found to have a mood disorder, including major depression, bipolar disorder, and dysthymia. Further research has concluded that ED is individuals engage in the picking from multiple body sites for extended periods of time. They target both healthy and previously damaged skin. These experiences that lead to picking uh, could possibly include urge or physical tension prior to picking, unpleasant emotions, cognitions, sensations, and displeasing aspect of one's appearance. I would like to go into the etiology now. A lot of the research did base a lot of these facts off of trichomania disorder. Um, one of it being the biological factors, which included genetics, predispositions, neurological sensitivity, emotional stimuli, which results in emotional impulsivity and need to self soothe. Then we have the psychological factors, which help regulate uncomfortable emotions. Um, so, individuals who are going through uncomfortable emotions and negative emotions um, turn to skin picking as a comfort feeling. It can become a behavioral reinforcement coping mechanism used to manage these types of negative feelings. There are high levels of emotional impulsivity, and they experience there is experience of obsessive thoughts with the constant picking. Assessment was I had taken assessment from Kathleen et al. 2001. They have uh, reported three different types of questionnaires. One of it being skin picking scale, which measured clients' self-reported severity of skin picking behaviors, and this was a 6 item related to skin picking behaviors. And second, we had a skin picking impact scale, which was a self reported questionnaire to assess the impacts and consequences of repetitive skin picking. And our last one, skin picking impact scale, which is simply just a shorter version of that second questionnaire. And this third one was just a 4 question scale. So the differentiation between OCD and ED is relatively clear in the sense of though they do both experience some type of distress, such as ED feeling of embarrassment by the condition of their skin and feeling ashamed, unable to stop from engaging in this harmful behavior. Uh, the difference lies lies with ED individuals' report of pleasurable gratification after picking at their skin. Behavior may not be preceded by an obsession or intrusive thought, and this is performed without any conscious awareness, and also it may require medical attention just because these skin pickings turn to lesions, and lesions uh, eventually become affected. Treatments. So it has been reported that 30% to 45% seek treatment. So obviously, not everybody seeks treatment, and as mentioned before, it may be due to being ashamed or awareness as well. Um, there were multiple different types of treatments, whether it was therapy treatment or medication treatment. And I would like to start off with the uh, therapy treatment first. So, we first have acceptance and commitment therapy, ACT, which is used in conjunction with HRT, which is a habit reversal training. So, ACT uses mindfulness techniques to teach acceptance of negative thoughts and emotions, and then combines behavior change techniques to address unhealthy behaviors. And then we have dialectic behavior therapy, and then we have cognitive behavioral treatment, CBT. CBT it focuses using cognitive reconstructing to counter dysfunctional thoughts. And Our last one is habit reversal training, HRT, which is an effective strategy for working with these types of clients. Um, and HRT is a behavioral approach that involves helping clients gain awareness of their skin picking and then replaces the picking with more adaptive behaviors. So, these were just the few of the therapy treatments that were seen to be helpful with individuals with ED. And then we had medication, which consisted of selective serotonin reuptake inhibitors, SSRIs, consisted of Prozac, Celiac, uh, Lexapro, Lovax, Zolfate. And then my case study consisted of Sarah, who is a 26-year-old female with Israel descent. She was recently admitted into the hospital. She began skin picking sporadically and presented with complaints of excessive skin scratching, and skin picking of the fingers, forearms, and upper back for the last 3 years. However, in the past 2 years, the picking had been a daily routine, which was associated with emotional distress, followed by a feeling of relief after picking. She had a remote history of childhood physical abuse by her parents. She reports her environment was highly stressful and lacked support while growing up. During the psychiatric examination, though she appeared to act her age, she was very restless and appeared to be anxious regarding her appearance because of her skin lesions. She reported feeling depressed and feeling of guilt about her skin picking behavior. In addition, she also reports of a sense of enjoyment from this behavior but avoided going out to public places. So, as a conclusion, she has been diagnosed with having ED, and this conclusion came about because she is feeling relief after the picking, however, anxious regarding her appearance, and lastly, a sense of enjoyment due to the picking, which has lasted for several years now. So, this is my presentation. Hopefully, everybody has great rest of semester.